Hi, this is Tom Shanahan from spiritualadrenaline.me. I'm here today with Dr. Michael Bedecs, who's a triple board certified medical practitioner with practices both in New England and in Florida. He specializes in hormone replacement therapy and age management. His practice differs from traditional medicine in several ways. He primarily focuses on the root causes of metabolic imbalances rather than by simply treating the symptoms. Many of his patients identify as people in recovery, and the issues in his practice are interrelated. So Dr. Bedecs, thank you so much for coming out today. My question for you is, what common problems do you see in the blood work of patients who identify as people in recovery?
It's interesting to know that different substances will offer different problems in the blood work. And so knowing what the person has been using is important, and in many cases there's polyuse going on. But specifically, we'll start to look at liver enzymes, electrolytes, anemias, and interesting low white blood cell counts with people with, for example, cocaine and meth. Testosterone deficiency really is an interesting thing for people with narcotic addiction and sometimes very young men with really depressed testosterone levels.
Why is that?
I'm not exactly sure. I don't think anybody knows. But the interesting thing also to note is I've often felt that recovering people have felt embarrassed by their conditions and frequently, I think, are discriminated against by the traditional medical model and as a consequence may not seek out medical help as readily as they should have. So that many times recovering people have ignored general health issues and there may be things that have been ignored and need to be treated.
And as a doctor, if you have someone who's not fully disclosing their prior use and history, can you treat them?
My job is to have people get comfortable with me because it's important is I don't share information with anybody. So my practice is built clearly on anonymity. There is no reason for someone to not share information with me. So the answer to your question is yes, I need to know if I'm going to do a good job.
All right, Dr. Bedecs, thank you so much. If you're interested in more about what Dr. Bedecs does, you can visit his website at agemanagementcenter.com. Thanks again.